Welcome to adaptnclex. Let's do some questions. So I have these questions for you that I made it up, but like it's all based on content. You can make the questions anywhere you want. You can create your own questions as you study. So that's what I've done. It's a selector that apply. So SATA. So we read from the back forward. The next care of plan should include. So we're looking for care of plan. That means you are now the boss now. So you got to make a decision. The client was admitted with the second bout of acute diverticulitis, no abscess. White count is 16, 18. What plan of care should you include? So patient was admitted. This is the left side. He has a gumba there that is inflamed. Um, and then white count of 18. So what should the nurse include in the plan of care? I've told you guys that whenever they give you any GI pathology and he has HIDES at the name, that means there's either inflammatory or infectious process. So any GI problem, when the patient come in with the GI problem, your number one choice is make them MPO because you don't know what will happen. If you feed them, then there's a problem. So make them MPO as number one because they sick inside. So you don't want any fluid to go into the abdomen anymore. So you make them MPO. Guess what? If you make me MPO, you need to give me the fluid that I needed, that usually I drink. So they get an IV fluid. You look at it, diverticulitis, look at it, it has HIDES there. Whenever you have HIDES, that's an inflammatory process, you're going to have pain. And it's a HIDES, therefore you get an antibiotic. It's an HIDES, that means there's inflammation. Therefore, you don't want to cause anything that will cause more inflammation, that will cause this perforation. And enema will do that. And colonoscopy, nothing go into the rectum because it's already inflamed. It's going to perforate it. So these two enema, you don't need to give it to them, and then they don't get a colonoscopy. So these two are wrong. 1 and 2, 5 and 6 are wrong, and 3, all the 1 to 4 are what you do with patient with this condition. They get an MPO. MPO, you give me fluid. If there's inflammatory process, you give me antibiotic. And from the antibiotic, I get a white count, slow but sure. But we can take care of the patient as soon as possible. So you don't need you don't need to do any enema or colonoscopy. It has to be like nothing by mouth, IV fluid, pain management, antibiotic, and no enema and no colonoscopy. Okay. So a nurse is caring for a client who underwent cardiac catheterization. Which of the following need immediate intervention? So now we have our last patient at a true cardiac catheterization. Which of the following need immediate intervention? We have to make sure that we're following the strategy that we talk about. And so you see what symptoms that is there that will need immediate intervention. The first one is lie flat on the bed for 6 hours. Yeah, that's what the patient is supposed to lay down for like 6 hours. Make sure you don't go and run, play basketball. No. A map of 55, that is too low. Okay, it's like 60 above. Therefore, we need to do something. The patient may be bleeding. Okay. Urine output of 20 cc for 8 hours. The same thing, the patient may be bleeding. That's why they have urine output that low within for 8 hours. That's barely, they don't even make the minimum value. That's really bad. They're bleeding, they are in shock right now. Then 3 plus pauses, that means it's a normal pause. So you don't do anything about it. So these two patients, they're bleeding. The muffled heart sound with the narrow pulse pressure. We just did a cardiac catheterization. All of a sudden, we're hearing muffled heart sound and a narrow pulse pressure. Yes, muffled heart sound, narrow pulse pressure. That sound like tamponade to me. So basically, whoever did the cardiac cath may have perforated the pericardium. There's now fluid in the pericardium. The patient is having tamponade. So we need immediate intervention on that. So 2, 3, and 5 need immediate intervention. This is how you do sort of question. Take care of yourself, enjoy, and then see you later. Bye bye.